Guys, here we will give you all 200 question with most accurate answers. First question: a 22 weeks premigravida came with the profuse vaginal bleeding. Her BP was 110/70 and normal blood glucose level. What would be the site of implantation to cause severe vaginal bleeding? The answer will be the internal was. Question number 2: a 32 weeks female patient comes with history of the 2 weeks delayed menstrual cycle with vaginal bleeding and abdominal pain. She had normal regular cycles. UPT is negative, but her beta-IC is 1400. In USG, adnexa is clear. Parabdominal uterus is soft. What will be the next step of management? Answer will be repeat beta-ICG after 48 hours. Question number 3. A patient comes with altered sensorium with respiratory distress. History of opioid poisoning. What will be the drug of choice of this patient? Answer will be the naloxone. Question number 4. There is an image-based question of the nail, and there was nail pitting and Waldorf sign. What is the diagnosis? The diagnosis will be the psoriasis. Question number 5. 11-month-old child, history of the recurrent vomiting with pain abdomen, and in the image there was just clutching hand, so that's why the answer will be the intersusception. Question number 6. Diagnosis of the bone. In this question, most of the faculties are telling that the answer will be the incus, but I marked malleus as I did not found any short process of that bone. I don't know what will be the exact answer. Then question number 7. What is the scan? This scan will be the PET scan. Question number 8. HSG done in a 32-year female patient. What is the type of the uterus? The answer will be the septate uterus, as the angle between these two uterus was less than 40 degrees. So that's why I think it will be the septate uterus. Question of the lipid. Question number 9 is there was a question of lipid laden macrophage resembling crumpled tissue paper appearance. What is the deficiency can lead this? Answer will be the glucocerebrosidase. Question number 10. Cherry red spot is seen in which case, and there was the neuronal involvement, so that's why answer will be the Tay-Sachs disease. Question number 11. McArdle disease was the diagnosis of that question, so that's why this McArdle disease occurs due to the deficiency of enzyme myophosphatase. Question number 12. There is 0.3 centimeter ulcerated nodule has grown the medial epicanthic fold. That was the image-based question. So answer will be of this question will be the basal cell carcinoma. Question number 13. A patient had Samtat triad. Which drug should avoid for this patient? Answer will be the aspirin. Question number 14. A patient following RTA developed blood at meatus, and there was the image given. What is the diagnosis? The answer will be the membranous urethra, but I marked there in this neetpg bulbar urethra, as I did not find any extravasation of dye in the inner pelvic area. But I think answer will be the membranous urethra now. Most faculties are telling that there was a pelvic fracture. Then question number 15. That was the image-based question. That answer will be the vitamin A deficiency. Question number 16. A middle-aged lady with the candy white discharge. What should be your next investigation? The answer will be the CHROM. Question number 17. Most common complication of the untreated radial head dislocation. That was a image-based question. So most appropriate answer will be the malunion with cubitus valgus. Question number 18. Rice watery diarrhea occur by which of the ganglioside? The answer will be the GM1. Type of the uveitis seen in the sympathetic ophthalmopathy. Answer will be the pan-uveitis. Question number 20. Patient had previous history of the cesarean section. Now she is 34 weeks pregnant by USG, and the fetus is in breech position. What will be the management? The answer will be the cesarean section at 37 weeks. In which disease this is seen? This is an image-based question, so that's why answer will be the pseudo exfoliation. Question number 22. Stimulation for the testosterone release in fetus. So answer will be the HCG production from the placenta. Uterine artery Doppler done at the 12 to 14 weeks. What could it defect? The answer will be the early onset of the preeclampsia. A CLD patient with ascites with increased polymorphonuclear cells, what it denotes? It denotes that it is a spontaneous bacterial peritonitis case. Question number 25. Frequent pus discharge from the perianal area. What could be the diagnosis? It is a controversial question, but most appropriate answer will be the fistula in ano. Question number 26. Followed by the varicose veins surgery, patient comes with the loss of the sensation in the medial side of the leg. Which nerve is involved? The answer will be the saphenous nerve. Question number 27. Which is not found in the men 2B syndrome? The answer will be the parathyroid adenoma. There is an image based question of the bed sore and the grading was asked. The answer will be the grade 4. Question number 29. Female with UTI started antibiotics and that causes the tendon injury. So mechanism of action of the drug will be DNA gyrase inhibitor. Question number 30. A psychiatric patient on TCA medication and after that TCA medication toxicity happened. So what will be the management? So I think most appropriate management will be the IV bicarbonate. PCSK9 inhibitor question was asked, so that answer will be the evolocumab. Question number 32. Growth hormone receptor antagonist, so that will be the pegvisomant. Question number 33. Which of the following drug is least side effect on the pleura? So I think most appropriate answer will be the metformin. 34. If a farmer having the trauma injury and there was a lesion picture and there is a cauliflower like growth and in history copper penny betis are seen, so that's why the diagnosis will be the chromoblastomycosis. Question number 35. A 60-year-old patient presented with the severe epigastric pain, pulse 100/10, BP হচ্ছে 90/60, X-ray is given. What will be the management? Management will be the resuscitate and laparotomy. Saccular aneurysm is seen in the subarachnoid hemorrhage. Question number 37. G6PD deficiency affect the HMP pathway. Question number 38. Complex 4 inhibitor of electron transport chain is cyanide. Question number 39. There was an image given of pneumothorax, so that's why management will be the ICD insertion. Question number 40. Diagnosis of the image. There is image based question. I think most appropriate answer will be the bladder strophy. Pregnant woman coming on the 3rd day after delivery, depressed mood. What will be the diagnosis? The answer will be the postpartum blue. Patient with the history of the COVID, 8 months and 8 months back, image showing the hair fall. Patient with a history of COVID, after 8 months there was hair fall, so that's why most likely cause of this hair fall will be the telogen effluvium. Then question number 43. An antiemetic that was used with cisplatin, which antiemetic caused the Parkinsonism like fissures, so that's why that's symptom are due to the extrapyramidal symptom of the metoclopramide. Question number 44. There was a picture given of cystometrogram and image was asked for the Laplace law for which segment? So answer will be the 1B, this middle segment. Then question number 45. History of the sickle cell anemia in a child now develops the sign of the hypopigmentation, so osteomyelitis happens. So what is the likely the cause? I think this most appropriate answer will be the salmonella. Question number 46. There is an image based question of the scrotum. Diagnosis will be the Fournier's gangrene. Question number 47. Image of the amputation of the toes given with the impotency. So at which level of the obstruction seen? The answer will be the aortoiliac bifurcation. There was a picture given of a investigation. The answer will be of this investigation USG Doppler. Question number 49. A delayed intravenous urogram of the patient is shown in the image. What is the most likely diagnosis? I think most likely diagnosis will be the pelvico-ureteric junction obstruction, and as this picture taken after the delayed intravenous urogram, so most appropriate answer will be pelvic pelvico-ureteric junction obstruction. Question number 50. A 6-year-old child with the recurrent UTI, what is the most likely diagnosis? Answer will be the vesico-ureteric junction, vesico-ureteric reflex. Question number 51. A 35-year-old female presented with the fever, expectoration with difficulty breathing, HSCT of the chest was performed and a lesion was seen. Diagnosis will be the consolidation with air bronchogram. Then a image based picture was asked for the diagnosis, and there was calcium deposition in the oral area, so that's why answer will be the cyalolithiasis. Question number 53. A 2-year-old child presented with the sudden onset of breathing difficulty while playing. There are no prior history of any breathing disorder. Chest X-ray revealed the unilateral hyperinflated lung with normal left lung. Which of the following statement is true regarding the statement? This is a controversial question, but I think most appropriate answer will be the focal area of the decreased air entry confirms the diagnosis, as this is a case of foreign body. Then next, question number 54. A 65-year-old hypertensive on the multi-drug treatment with the poor compliance presented with the sudden onset of breathlessness. A chest X-ray is done and shown below. What is the most preferred treatment for such case? The treatment will be the IV nitroglycerin. Question number 55. A 25-year-old patient presented with the fever, dry cough, breathlessness and night sweat, weakness both sides of the face, and decrease the vision of the right eye. On chest X-ray, bilateral hilar lymphadenopathy was seen. So what is the most likely cause? The most appropriate diagnosis will be the sarcoidosis. Question number 56. There was a question for this image based, so that's why this investigation will be the thromboelastography. Question number 57. A 16-year-old girl has intense craving for the food after eating large amount of the food followed by the recurrent vomiting. Most probably diagnosis will be the bulimia nervosa. Question number 58. A female comes to the gynecologist for hysterectomy and discusses with the doctor about the advantage and disadvantage of the procedure available. Which type of the consent is this? This is a informed consent. Question number 59. A 40-year-old male having acute loss of the hair with loss of the lateral part of the eyebrows and eyelash. And what is the poisoning? Poisoning asked. So the diagnosis will be the thallium poisoning. Question number 60. During certain procedure in the trial, the lawyer of the defendant asked a leading question and the opposite lawyer quickly raised an objection. The judge sustained the appeal and requested the defending lawyer to avoid leading question, as they can't be allowed in any of the following except. So except option will be the answer of cross examination. Question number 61. Identify the wound of this image. This is a case of defense wound. Question number 62. A child has consumed lots of the iron tablet and the brought to casualty with the fissures of the pain abdomen, profuse gastrointestinal bleeding, and is lethargic and comatose. Preferred treatment of this case will be the desferoxamine. Question number 63. The enzyme defect in a case of the lead poisoning. The answer will be the ferrosilatase. 64. There is an image of the bullet injury. I think the most appropriate answer will be the pistol shot from near contact. It is a controversial question, I know, but I think it is most appropriate. Question number 65. Woman comes to the ER with history of the intake of 20 paracetamol tablets. According to the doctor on duty, which drug should be started? Answer will be the N-acetylcysteine. Horizontal ligature mark is seen in all around the neck and it is lying over the thyroid cartilage. No dribbling of the saliva seen. What is the right option? The answer will be the ligature strangulation. Question number 67. There was a question asked for the burn area calculation. So most appropriate answer will be the 15 to 20%. Question number 68. Identify the type of the hymen shown in the image. I don't know appropriate answer, but I think most appropriate answer will be the septate. And I marked it semilunar in that exam, but I think this is a controversial question. Answer may be different. Question number 69. A surgeon drank alcohol 4 pegs At the time of the surgery, he drops instrument and cuts the major artery. What will be the negligence? It is a case of criminal negligence. Question number 70. An infant with developmental delay is admitted to the ICU with recurrent episode of the abnormal movement. ECG showed hip arrhythmia. Which will be the drug of choice? It is a case of the salam spasm. So drug of choice will be the injection acetate. A neonate not passed urine for the day 1. Question number 71. A neonate not passed urine on day 1 and brought to the emergency. What should be the next step? This is a controversial question, but I think most appropriate answer will be the continue breastfeeding and observe. As the neonate came to on day 1 but not completed her 24 hours. So that's why it is not a case of the kidney failure. Question number 72. A patient presented with the multiple swelling in hand and X-ray of wrist was seen. So what is the diagnosis? That is a case of multiple enchondroma. Question number 73. Which will be the ideal treatment for fibular fracture? The answer will be the neurological assessment, then analgesic, then cast. This is a controversial question, I know, but most appropriate answer will be is this. Question number 74. Give an image of a radiograph of shoulder joint of a 13-year-old child presented with the fall on elbow. Which of the bone has a fracture? I did not find any fracture in that X-ray in exam. I marked a scapula. I think this is a controversial question. So let's consider it. You are given what thing that will be right. Question number 75. Identify the following in which condition this procedure indicated. There was a picture given of a spanning fixator, and the most appropriate answer will be the periarticular fracture of the knee. A spanning fixator. Question number 76. Which of the following condition will cause intermittent breaking of the long bones in a child? The answer will be the osteogenesis imperfecta. Identify the equipment commonly used in the ICU. That will be the non-rebreathing mask. Question number 78. 60-year-old male dragging abdominal pain, peripheral blood smear, leukocytosis with the increase in basophil, myelocyte and metamyelocyte. Which of the following translocation is the seen in patient? Answer will be the chromosome number 922 translocation. This is a case of the CLL. Question number 79. 34 weeks of gestation, BP 150/90, ALT 75, LDA is 400, platelet 75,000. What is the diagnosis? The diagnosis will be the HELLP syndrome. Question number 80. Which one is the method of delaying aging process? This is a controversial question also, but most appropriate answer will be the calorie intake restriction 30%. The alternative answer can maybe removal of the stressor, but I don't know what will be the exact answer. Next question number 81. All of the following are true about neutrophil entrapment except the most appropriate answer will be the mitochondrial DNA is involved. Then question number 82. Why does cancer cell utilize Warburg effect? The most appropriate answer will be the useful to make intermediates for survival. Question number 83. Single nucleotide change resulting in the stop codon called nonsense mutation. Question number 84. A trauma patient was undergo emergency laparotomy, wanted to monitor the coagulation studies. Whose investigation is the choice? Thromboelastography. I think this question I am repeating, but I will add the extra one question at the last. Question number 85. Which is the autosomal recessive inheritance? Answer will be the cystic fibrosis. Question number 86. Case of a hyperchromic microcytic anemia with reduced RBC indices and target cell present. RBC count of the peripheral blood smear was 5.2 into 10 to the power 9 per cell cubic meter. What will be the next step? The answer will be the HbA12. HbA2 will be the answer. Then next question number 87. A patient underwent cystoscopy which showed that multiple yellow white plaque in the bladder mucosa with infiltrated lymphoid follicles. The histopathology picture was shown. What is your diagnosis? Many faculties are telling that this answer will be the malakoplakia, but I marked follicular cystitis as I thought that was infiltrated with lymphoid follicles, and I studied that lymphoid follicle infiltration occurs in follicular cystitis, but I don't know the exact answer. Next question number 88. Middle-aged female with the painless, slow-growing neck swelling, lymph node is palpable, surgery done, biopsy peak was given. What is not true? So answer will be the FNAC is not diagnostic. That will be the not true. Question number 89. A 27-year male after 2 days of the RTA developed sudden onset of the respiratory distress, petechiae, rash and unconsciousness. What is the likely cause? The answer will be the fat embolism. Question number 90. 10-year-old male presented with the edema and analgesia, anasarca, diagnosis of the minimal change disease. The true statement will be the respond with steroid well. Question number 91. A 30-year-old male investigated for the infertility. Semen analysis shows the azoospermia. Biopsy shows a picture was given there. So most appropriate answer will be the Sertoli cell tumor. Question number 92. 12-year-old male presented with the bloating, steatorrhea, and there was a gene mutation of the ACLA-DQ2. So treatment will be the gluten-free diet. Question number 93. A 40-year-old female with arthralgia, oral ulcer, joint pain, oliguria, hematuria, RBC clusters seen in the urine. So most appropriate answer will be the lupus nephritis. Question number 94. 40-year-old female with Question number 94. A 40-year-old female with hemorrhoids, hemoglobin is low, peripheral ischemia showed microcytic hypochromic anemia. Diagnosis will be the iron deficiency anemia. Question number 95. Middle-aged patient died of COVID-19. She was on ventilator. What will you find in alveoli? I think this is also a controversial question, but most appropriate answer will be the thick fibrin lining the alveoli. Question number 96. Multiple vaginocervical warts. Picture was given there, and DNA analysis was suggestive of the high risk of squamous cell carcinoma. Which will be the maximum risk of squamous cell of carcinoma? The answer will be the HPV 18. So next question is question number 97. A 6-year-old male presented with the pain in the extremity. He was admitted with the history of the chest infection 2 years back. HPLC showing normal HbF and HbS. So diagnosis will be the sickle cell anemia, as there was normal HbF. So HbS count was raised, so that's why the answer will be the sickle cell anemia. Question number 98. In this procedure to monitor neuromuscular blockage, which nerve is being tested? Answer will be the ulnar nerve. The surgery is done for the keratoconus. Question number 100. Patient of rheumatoid presents with this ocular finding. Diagnosis will be the scleromalacia perforans. Question number 101. A diabetic patient Question number 101. A diabetic patient with neovascularization in retina. Treatment will be the pan-retinal photocoagulation. Question number 102. A patient comes with the photophobia, lacrimation, headache, which nerve supply is affected. There was a picture of the cranial cavity with nerves. So I think most appropriate answer will be the trigeminal nerve. Question number 103. At what level uterus is felt on second day of the post delivery? I think most appropriate answer will be the one finger below the umbilicus. As if you read the involution chapter, you will find that within 24 hours, there within after delivery, there is the level at the umbilicus. So that's why I think this is the most appropriate answer, but I am not sure. This is controversial. 104. Identify the histopathological tissue structure marked. Most appropriate answer will be the Langerhans cells. Question number 105. In a image, which part of the pelvis is asked? Answer will be the mid pelvis. Image of the peripheral blood smear shown raised LDH, elevated bilirubin, hemoglobinuria present, cystocytes present. Which of the following will be the seen in this case? The answer will be the mechanical second heart sound. Question number 107. A case of preeclampsia, post-cesarean section. A patient is type 1 diabetes. Her blood sugar is 280 mg per dl. Respiratory rate is 10. Urinary output is decreased. Patellar reflex was decreased. What is the cause? The cause will be the max out toxicity. Question number 108. The umbilical cord being given traction got torn and led to excessive vaginal bleed. Which of the following is the most appropriate step? I think most appropriate step will be the manual removal of the placenta. Question number 109. Multigravida was in second stage of the liver for more than 2 hours. On pervaginal examination, fetal head is palpable at the level of the ischial spine. Sagittal suture is palpable in transverse diameter of the inlet. Molding double plus, caput double plus. What is the function? What is the further management? I think the most appropriate answer will be the LSCS, as this is a case of the obstructed liver. 110. Question number. Secondary wave of the trophoblastic invasion. The cause will be the invasion of the spiral artery by extravillous trophoblast. Question number 111. A mother has 18-month-old baby with breastfeeding. Mother has history of the irregular and heavy menstrual bleeding. What is the choice of the contraception of this mother? I think most appropriate answer will be the Malayan. Many faculties are telling that answer will be the Post-Cert, but I don't think so, as OCP is not contraindicated after 6 months, as exclusive breastfeeding is completed. So that's why most appropriate answer, I think that will be the Malayan, as there is a history of irregular bleeding. To regular menstrual cycle to get, you have to do prescribe OCP. Next, 112. Copper T is contraindicated in. Answer will be the post-molar evacuation after trophoblastic disease. Question number 113. Absolute contraindication of the cervical circles. This is also a controversial question, but I think most appropriate answer will be the ruptured membrane. Question number 114. Recommendation after surgery for vesico-vaginal fistula. And most appropriate answer will be the abstinence for the 6 months and avoid pregnancy for the 1 year. Question number 115. Drug used for the abortion in 7 to 8 weeks of gestation. Answer will be the mifepristone plus misoprostol. DNA packing is done by. Answer will be the histone. Question number 117. FAD status in body is determined by the glutathione reductase. Question number 118. Relation between telomeres and aging is gradually decreasing length of the telomeres. Question number 119. Alcoholic patient, there was isoniazid therapy and patient is getting tingling sensation. Which vitamin is deficient? The answer will be the vitamin B6. Question number 120. Fatty acid transport through which molecule? Answer will be the carnitine. Question number 121. There is a picture of the acanthosis nigricans and the disease is associated with the. Answer will be the metabolic syndrome. Question number 122. A patient of the diabetic ketoacidosis, what will be the management? The management will be the fluids with regular insulin. Question number 123. A patient with features of the jaundice, direct or indirect bilirubin increase, most mostly increased direct bilirubin. So that's why this is a case of the obstructive jaundice. Question number 124. There was a question asked of MDR TB by which drug resistance. So I think this is the answer, isoniazid and rifampicin resistance. Question number 125. There was a question asked of relative risk, and relative risk was given 0.86. So and they asked for the identify correct statement. A most appropriate statement will be the people drinking green tea are more protected as compared to those who are not drinking. Question number 126. A Japanese woman with life expectancy is 87 years. Due to some intervention, life expectancy is increased. What is this? This is also a controversial question. I marked quality adjusted life years, but some faculties are telling that the answer will be the disability adjusted life years. But I think most appropriate answer will be the quality adjusted life years. Question number 127. Prostatic carcinoma has metastasized to the lumbar vertebra. What is the root? This is also a controversial question, but I think most appropriate answer will be the prostatic venous plexus. Question number 128. Image of a child with history of the stapon to abdomen content was coming out. Definitive management. So that's why it is the management will be the emergency operation and laparotomy. Question number 129. A ECG was given. There was the flat T wave and question number 129. The question was asked of a ECG features. There was flat T waves and prominent U wave. The appropriate answer will be the hypokalemia. Question number 130. Patient with atrial fibrillation history and JBP finding was asked. The answer will be the absent A wave. Question number 131. Patient with fissures of the acromegaly undergoes surgery, but fissures are not reduced. Drug to be used now. The answer will be the octreotide. Question number 132. Discharging sinus from the question number 132. Discharging sinus from the foot. Correct option is can be caused by both bacteria and fungus. Question number 133. A patient with the prolonged rest on his arm and complain of the tingling sensation but not pain. Why? The correct statement will be the A fibers are more susceptible to pressure than C fiber. Question number 134. ECG showing the ventricular tachycardia in a patient with chest pain. So treatment will be the IV amiodarone. Question number 135. Following thyroidectomy, which investigation to be performed for further problem? The answer will be the calcium and parathyroid. Question number 136. During delivery, there is excessive bleeding and suddenly collapse. So what is the diagnosis? I think this is also a controversial question. Many faculties are telling this is the amniotic fluid embolism, but I marked postpartum hemorrhage as during delivery there was excessive bleeding. So there is a history of bleeding history. So that's why I marked postpartum hemorrhage. I don't know what will be the exact answer. Then question number 137. A patient with high frequency hearing loss due to damage of the basilar membrane structure closest to it. I think most appropriate answer will be the oval window. It is also a controversial question. There is a image of cartilage. The answer will be the white fibrous cartilage. Question number 139. A patient with symptoms of the Duchenne muscular dystrophy. Correct statement will be the death by second to third decade. Question number 140. There was an image given and set point is asked about the set point correct statement, and answer will be the shivering. There was a ABG given, so answer will be the respiratory acidosis. Question number 142. Drug that decrease the extracellular potassium and move them into the cell. The answer will be the epinephrine. Question number 143. Post-COVID features of the nerve involvement in a diabetic patient. Next step will be the MRI brain. Question number 144. There is a mass in the nasal endoscopy. History of the recurrent bleeding. Patient of second decade. Answer will be the juvenile nasopharyngeal angiofibroma. Features of massive oligohydramnions. The answer will be the renal agenesis. Question number 146. A TB patient completed his treatment and test was done and there was negative for the TB. So what will be the status? The status will be the cured. Question number 147. 3-day-old neonate had TSH more than 1000, USG shows ectopic thyroid gland. Next line of the management. That will be the most appropriate answer of technetium scan. Ballistic movement due to involvement of the which nucleus? Answer will be the subthalamic nucleus. Question number 149. Baroreceptor mechanism in BP control is done by which mechanism was asked? The answer will be the negative feedback. Question number 150. A 65-year-old patient with deviation of the angle of the mouth, inability to blow, which nerve is involved? The nerve will be the 7th nerve. Question number 151. Which ligament derived from the, there was image based question and asked for the which ligament derived from it. So I think that ligament was coming from the ventral part of that image. So that's why it will be most probably falciform ligament. You see, it is also a controversial question. Question number 152. Most common site of the intraperitoneal abscess. It is also image based question, and in image I think the most appropriate answer will be the Morrison's pouch, and in image there was marked by 4. Question number 153. A pregnant woman of urban area of Madhya Pradesh motivated by Asha and got delivered. Incentive under JSY will be the 1000 rupees to mother, 400 rupees to Asha. Question number 154. Manure and seed distribution by which organization in nutritional health program? Answer will be the UNICEF. Question number 155. A medical officer job as a medical officer job in the primary health center will be the public health education. Question number 156. There is a question about the vaccine and they asked for the true statement. The answer will be the use pentavalent and discard MR. Question number 156. Broken vial discard in blue color bag. Question number 158. Most logical and cost effective approach for controlling the rabies in urban population. This is also a controversial question, but I think most appropriate answer will be the remove stray dogs and vaccinate dog population. Question number 59. Many children from a community coming to the hospital were detected as ALL. Hospital said due to the chemical odor this disease has happened. In case control study to find that chemical and ALL unassociated, what will be the taken as control? The most appropriate answer will be the children with ALL not exposed to chemical odor. Question number 160. In which the infant is in risk? That will be the question number 1 and question number 5. Single mother and artificial feeding, only these two options will be the true. Question number 161. What is true regarding need to start urban CHC in an area? The most appropriate answer will be the 100 beds under 1 urban CHC. Question number 162. A 12-week premigravida came to you for checkup. Correct advice you will give to her regarding the additional calorie intake. I think this is also a controversial question, but most appropriate answer will be the additional 300 calorie in all trimester. Question number 163. A baby with diarrhea at 4 weeks born to HIV mother, what should be the done? Most appropriate answer will be the check HIV DNA PCR to know viral status of the body. Question number 164. Borderline tubercular leprosy lesion over the forehead and extend to the bilateral cheeks. Which nerve is involved? The answer will be the bilateral trigeminal nerve palsy. Question number 165. Digoxin overdose induced arrhythmia managed by the digoxin immune fab. Mechanism of the action of the botulinum toxin. Answer will be the prevent of the acetylcholine release presynaptically. Question number 167. Features of the suggestive of migraine. Immediate drug to be given is sumatriptan. Question number 168. Patient with recurrent episode of the headache and vomiting. Diagnosis of the pituitary adenoma. Does not need surgery. So this was a case of the prolactinoma. Which drug you will advise? The answer will be the bromocriptine. Question number 169. Patient with the tumor lysis syndrome, which management you will do at first? The answer will be the hydration. Question number 170. Patient with tremor, rigidity and bradykinesia, facial expression of Parkinsonism like features, managed by? The answer will be the selezilin. Question number 171. Purity orange breast appearance seen in the subdermal lymphatic obstruction of breast. Question number 172. Patient with aminoglycin develops seizure and diuresis. It is due to the adenosine A1 mediated receptor. Question number 173. There is a picture of the cell communication type. The most appropriate answer, I think, will be the paracrine. Question number 174. A 12-year boy with nighttime with right upper quadrant pain, icterus fever. Examination shows the tender hepatomegaly with history of the dyspnea, hematuria. I think most appropriate answer will be the leptospirosis. Question number 175. Military person with rash on the body, sparing palms and shoulder, and the vector was body louse. So most appropriate answer will be the rickettsia prauseki. Question number 176. Best investigation to detect the Clostridium difficile associated diarrhea. The answer will be the GDAs and toxin assay. Question number 177. A child with hearing loss for 2 months, in otoscopy finding fluid and air bubbles is seen. The most appropriate answer will be the serous otitis media. Question number 178. Adult male in restaurant sudden choking on food. The next step will be the Helmholtz maneuver. Question number 179. Which step is not included in WHO step process? The most appropriate answer will be the therapeutic approach. Question number 180. Antibiotic prophylaxis is not required for preventing infective endocarditis will be the, I think most appropriate answer will be the untreated cyanotic heart disease. But I marked ASD. I don't know what will be the exact answer. Question number 181. There was a picture given of IV fluid composition, and most appropriate answer will be the ringal lactate. Question number 182. Secondary prophylaxis for rheumatic heart disease in a 13-year-old child with no features of the carditis or valvular disease. Answer will be the 5 years or until 18 years. Question number 183. A image was given, and that was a solid swelling over the parotid region, and that swelling was not painful. So that's why the swelling is due to the parotid swelling. Question number 184. Red tender pulsatile swelling with fever at the left upper chest area. What will be the next best step? The next best step will be the USG. Question number 185. A picture was given that showing the gangrene type lesion on the foot. Causing agent will be the warfarin. Question number 186. A child with increased TSH thyroid level is normal. Best test for assess functional status. I think this is a controversial question. It may be the answer of urinary iodine excretion or thyroid receptor antibody. If there was mentioned, if there is a clue for the ectopic thyroid, then the answer will be the thyroid receptor antibody. But if there is no clue for the ectopic thyroid, then answer will be the urinary iodine excretion. Question number 187. A clinical history is given with patient with the some lung disease. Findings showed the broad septate hypa with obtuse angle branching invading the blood vessels. What will be the treatment? Treatment will be the amphotericin B, as this is a case of the rhizopus or anything. Question number 188. An alcoholic patient presented with the white patches in the oral cavity. What is the most likely diagnosis? Answer will be the leukoplakia. Question number 189. Green color in the trias signifies the ambulatory. Question number 190. In court trial, leading questions are not permitted in all of the following except cross examination. I think this question I am repeating, so that's why I will add 2 questions at the last. Question number 191. CSF specimen of patient is shown below. Report shows the mononuclear cytosis with moderate low sugar with elevated protein value. which of the following is the likely etiology? And there was a CSF sample and that showing the cobweb coagulum. So that's why most appropriate answer will be the tubercular meningitis. Question number 192. A truck driver present with the sudden onset breathlessness, vitals are stable. He was found to be HIV positive, having a pleural effusion. The culture of the pleural fluid shows temperature dependent dimorphic fungi with red pigmentation. What is the causative organism and treatment? Most appropriate answer will be the Taloromyces menifee and amphotericin B. Question number 193. A young child was brought by his mother complaining of the multiple episode of the loose stool, also complained of the drowsiness and lethargy. His skin pins was going back very slowly. The child did not accept breastfeed. What is the class of dehydration? The answer will be the severe. Question number 194. A 7-year-old male child presented with the palpable purpura over lower limb and buttock, complained of the arthralgia, abdominal pain, with previous history of the upper respiratory tract infection. What treatment option for the following condition? The answer will be the glucocorticoid. Question number 195. A patient with history of the travel to the Africa developed jaundice with hemorrhage, fever and conjunctival effusion. He was given treatment but died. Which of the following vaccine could have prevented this death? Answer will be the 17T vaccine for yellow fever. A 35-year-old patient reported suffering with the malaise and fatigue since last 2 months. On laboratory examination, his serum parameter depicted HbS-Ag plus IgM core antibody. So diagnosis will be the acute hepatitis B. Question number 197. Red pigment producing pencil-shaped microconidia. Answer will be the Trichophyton rubrum. Question number 198. Features of the microcytic hyperchromic anemia with HPLC showing HbA2 increased, HbF increase and HbS. I think most appropriate answer will be the thalassemia, as there is a increased HbF number. The two questions asked for the same type of question. One answer of that question will be the thalassemia and other will be the sickle cell anemia. Question number 199. The patient on antidepressant give history of the bleeding and fatty stools, which stick to the. Question number 199. A patient on antidepressant gives history of the bleeding and fatty stools. Which of the following vitamin deficiency is the cause of bleeding? So this is a case of steatorrhea. So most likely this is a case of vitamin K deficiency. Question number 200. A sheathing microfilaria with 2 nuclei at the tail end. The answer will be the Brucia malai. So my repeated question is question number 191. History of the sinusitis. History of the sinusitis, dichromatous branching at less than 45 degree. Identify the organism. The most appropriate answer will be the aspergillosis. Guys, I have completed 200 questions. In these questions, there are many controversial questions. You can comment here and you can comment of the answers with your logics of that controversial questions. Okay, thank you guys. I think I have done the most appropriate recalls of this 200 question. You can comment your score here also. We can create a poll and we can see how most of us are scoring.